Hi there, I'm Stephen Shepherd, I'm a consultant in intensive care, and I'm going to talk to you about the defib trolleys that we have here at Barts. So first thing to say is that the defib trolley is standardised across the trust, but the one thing you will notice is that all of our defibs are pacing defibs, and again all of the defibs on this site fulfill that role. We'll talk through the different drawers first, and then we will talk through the basics of how to operate the defibrillator. First thing to say is that the drawers follow an ABCD approach. So if you are to want to open it, you'll see here there's a lever. You can see also that it's tagged, which shows that it's been checked. When you press the lever, the tag will break. And then as you work your way down, you'll see that you get through everything that you would need in an emergency. So your top drawer is all about airway. So we've got oxygen masks, and we've got a self-inflating bag. We've also got endotracheal tubes, which come in a size 7 and a size 6 and a size 8. And we've got 2 Macintosh handles and 2 eye gels, a size 4 and a size 5. Enough to intubate most patients that you would come across. We've also got suction equipment, and we've got catheter mounts with the ability to connect to capnography, although there is no capnograph in this drawer. That will come in the grab bag from ICU, which the HCA will bring to every arrest. We've also got oropharyngeal airways and some syringes to inflate the cuff. So hopefully enough to be going on with. In the next drawer, you'll find kind of C problem. So this is about vascular access. So you'll find an array of syringes, you'll find some cannulas of various sizes, you'll also find a tourniquet, some blood bottles, and some giving sets for fluid, although again no fluid in here at the moment. But essentially everything that you would need for vascular access in an emergency. C is where you'll find your fluids, and we've got bags of both saline and Hartmann's, a couple of litres of each. We've also got pressure bags, and we've got spare ECG dots should you need them. There are also some vials of flush and some tape and spare paper for the ECG machine for when you come to it. D is for drugs, really. So we've got some 10% dextrose to treat hypoglycemia. We've got vials of adrenaline, atropine, magnesium, and bicarbonate. But again, most of your standard cardiac arrest drugs will be in this tray. If you go through all of this, there will be extra drugs available on pretty much every ward, or from another defib trolley and tray, which you can get from the adjacent area. Here you'll find a sharp spin, you'll find some gloves. We don't stock PPE on the defib trolleys. There is a stock of PPE for cardiac arrests, which is kept on every ward. And also with the bag that comes from ITU will come a grab bag of prepared PPE, which will be brought to the arrest for you. So if you come to arrest as part of the intensive care or anaesthetic team, ask to be directed towards this, or wait for it to come with the HCA. We're going to go through the defib now as well. So we use the LifePak 20. So this has both pacing and defibrillation functions. It has a battery of about 40 minutes, but should be kept charged on the ward. And you'll see it's pretty simple. You may see that it comes with a door. This one doesn't have one, but you need to open the door, which has a little switch, in order to get to the more advanced actions. Otherwise, it functions as an automated AED. So to turn it on, you press the on button. You'll see that we're not connected to anything apart from the test plug, so you need to remove the defib from the test plug and apply the pads to the patient and connect it. You'll then need to select paddles in order to read an ECG. If you want to charge, you can select your energy here. We use 360 degrees for all cardioversions at cardiac arrest. If you are in an unstable atrial tachy, the recommendation of the trust is 125, 200, and then 360 as a synchronized shock. But for everything else, it would be 360. You charge by pressing the charge button, and then defibrillation is through the red electricity icon. We wouldn't expect you to use this without training, so you can speak to your resus officers or to myself and we can arrange that. I'll be able to go through both the defibrillation and some of the more advanced pacer functions. However, there is a great wealth of experience within our centre as a cardiac hospital in dealing with pacing problems and defibrillation, so people will be there to help you. Any questions, give me a shout.